Good morning. Thank you for joining us for our press briefing. My name is Kelly Chandler. I'm the Public Health Division Manager for Itasca County. We're hosting a press briefing today in anticipation of school plans for this upcoming 2021-2022 academic year. We've invited our school leaders and the Itasca Community College Provost to speak on their planning for the year. We last hosted this meeting in May of 2021, and much has changed since then. Cases of COVID decreased from May until mid-July in Itasca. And since then, we've had an additional COVID-19 variant introduced, as has happened throughout Minnesota and in the United States. And this is the Delta variant. And this likely is a contributing factor to our current increase in positive COVID cases. Delta is different in how it presents. Initial symptoms often include sore throat, headache, and runny nose versus the initial loss of taste and smell and cough that often led the symptoms of the initial makeup of the virus. If you or someone you know develops the headache, sore throat, or runny nose symptoms, consider being tested for COVID. Our local clinics at Greenway, Itasca, and Essentia Health conduct tests, and results are arriving in the same day, which is so amazing and so helpful for people who are determining their risk of spreading the infection to others. The Delta variant is more infectious, meaning it spreads more easily between hosts. It is creating an increased illness in persons younger than we've previously seen. The good news is that vaccines remain effective against the Delta variant. In Minnesota, only 0.24% of positive cases are in people vaccinated. In Itasca County, only 0.38% of our vaccinated population has tested positive for COVID. These numbers really are amazing. The data shows that the vaccines are working to prevent COVID-19. The other piece to note about viruses and variants is that viruses can only spread and mutate if they have a host. They don't survive on their own. The more people 12 and older we can get vaccinated, the more we wear masks and stay home if we're sick, and stay 6 feet away from others, the sooner we can slow the spread and not offer this virus more chances to mutate and make people sicker. For those of you listening who remain uncertain about getting vaccines, or perhaps you are skeptical or even maybe vocally opposed to being vaccinated, we do want you to know it's so okay for you to change your mind. We have multiple people coming in now who weren't certain at first if they wanted the vaccine. Their reasons are really various, and there's no judgment if you change your mind. Once you have more information, it's only natural to make a different decision. Our clinics, pharmacies, and us in public health are more than happy to assist in getting you and your family vaccinated, regardless of any previous thoughts or opinions. I'll now provide a situational update on COVID. In Itasca, we have identified 45 new positive cases in the last 7 days, 113 new positive cases in the past 14 days, and cumulatively, we've seen 4,793 cases. And sadly, we have lost 69 of our Itasca neighbors from COVID-19. Our 14-day case rate per 10,000 as of August 16th is at 24.8, and this is up from a low of less than 1 in early July. We're monitoring this data closely as school is 3 weeks away in Itasca, and we recognize the uncertainty of the fall and recognize there are very strong opinions on both sides of preventing the spread of COVID, and particularly around mask wearing. I want to challenge our community members, challenge all of you listening today, instead of debating the issue, instead of contributing to the divide we have right now, perhaps maybe take a moment, stop and think about what we do agree upon. Where do our ideas align? One theme that we are hearing from both sides of the mask wearing controversy is that kids really do need to be in school. They need that in-person time with their teachers, their peers. They need less disruption in that learning process. And again, that is one area that most of us can agree upon. As our school leaders and staff move into the fall, know that they want your children in school as much as possible, and they will do their best to keep that in the forefront while they're still recognizing the seriousness of COVID-19. And to parents and youth out there, school plans will only work if we do our very best to recognize any early symptoms of illness in our children and keep them home until they are well. It will take all of us to make this a successful school year with as minimal disruption as possible. And thank you to all who are doing your part. I will now introduce Matt Grose, Superintendent of Big Fork and Grand Rapids Schools.
Good morning, Kelly, and good morning, others on the call. We are excited about the beginning of school, and like Kelly said, we are serious and about the safety of kids and having an environment that's excellent every day. In 318, many of the blankets and layers that we had procedurally and politically last year when we were in the same situation or similar have been removed. And so that's changed our decision-making process. It's changed many of the things about how we're looking into the future and starting school. But we're still trying to take our best advice and look to those around us that like Kelly, like our healthcare professionals and internal nursing staff to make good decisions about what's best for students. Right now, we know the CDC and the Minnesota Department of Health are strongly recommending masks, and in 318, we're strongly recommending masks too. We're not on September 7th requiring masks. We're strongly recommending, and we're hopeful that we'll get a high degree of compliance based on people's understanding of how masks work and that strong recommendation that we have. We think that by doing that, we can monitor that data, monitor student safety, and if changes need to be made, we'll be flexible, just like we were last year. We were having a similar conversation at this time about whether school would be face-to-face or whether school would be online. And we were consistent in our communication that we would adjust as we needed to based on what was happening in schools, and we did that during the year. One of the things we learned last year was that quarantining was really, really hard on families, and that quarantining was really, really hard on children. And so I think science in general is about learning from the data that we know about and adjusting to that, and we're adjusting to that too. We'll continue to isolate students that are sick. That's a requirement and really, really good practice. And so we'll continue to isolate students that are sick, and we'll monitor the quarantining situation. Right now, our plan isn't to quarantine all kids. We'll continue to contact trace to find out if we have a sick kid or a positive case. We'll close contact, find out who is near that child, and we'll notify parents, guardians of that, and have them monitor for symptoms. And we also have some testing opportunities that I'll talk about in a second. But again, the quarantine thing was really, really disruptive. We know that that's a tool that we used last year a lot. It's a tool that we can use again. We want to be really discriminate about how we do that and discerning about how we do that. We did find out on Tuesday, Minnesota schools did, that the Department of Education is going to support schools with testing. And that includes both symptomatic testing in ways that we didn't have before. And so one of those opportunities is through rapid testing, and we're still learning more about what's going to be available to us. But it looks like there may be rapid tests available for us to do at school, which would enable us to return a kid back to class in 20 or 30 minutes if the test is negative. And we might be able to provide those types of rapid tests to parents, where again, we'd be able to ascertain whether a student was positive or their symptoms were related to COVID or not rapidly, rather than having to wait. The other type of testing that we're investigating, and it looks like we'll be supported with, is screening testing. And so that's testing students and staff as a whole, and to be able to check to see how healthy we are as a school and whether there are asymptomatic cases. Testing like that would obviously require parent approval and permission. It's not something we would do without that. And so I know that's a question that we get sometimes from parents, but it would be a way for us to monitor what's happening in schools and, again, make decisions about quarantining, make decisions about masks if we, based on what we know about what's happening in our schools. We'll continue to promote and support vaccination. That's important. It clearly works. The data is there. And we're working with public health and public health agencies or healthcare providers to support that and promote that. We've had a number of our students I know in getting vaccinated this summer. We had many of our staff get vaccinated last spring. And so we're excited about that. I think a really important thing, and Kelly touched on this, is just the importance of parent cooperation. We had many cases last year where we had students come to school that were sick, and that led to some of the problems that we faced. And it's just not something we can have. We need to work together as partners in this. If students are sick, they need to stay home. We're going to promote testing so that we know if that sickness or illness or those symptoms are related to COVID or something else. But we need that partnership with parents in order to keep our kids safe and our schools healthy.
Thanks, Matt. We will now hear from Jennifer Steffen, Principal, King Elementary School in Deer River.
Good morning, everyone. I'm happy to be here representing the Deer River School District as the principal of King Elementary. And I'm also thankful to follow Superintendent Grose, because I can certainly say in 317, everything that he has shared could be, 318 could be echoed in 317. I'll start with where we are at with masking, and we are welcoming and recommending mask wearing as well at King Elementary, because our young learners are not able to be vaccinated yet. We are strongly recommending that all staff and students at King Elementary and our King Learning Center will be masked as we start the school year. We are basing our Fall Safe Schools plan off of successful summer programming that we had both at King Elementary and the Deer River High School, and also following and learning from the lessons from the last school year in regards to our cleaning protocols and good hygiene practices. So we'll be bringing those into the school year as well. And I just wanted to highlight a couple of things. Of course, we are, as district leaders, working diligently to plan for a safe school opening. We are moving forward with some of our traditional activities to welcome back our students. So we have sports happening this week, which has been wonderful for our students to be involved in. And we have a couple of back to school events happening. We have a 6th grade orientation at the Deer River High School, which will take place on August 25th, and that starts at 6:30. And then we do have a back to school open house at King, which is on September 1st from 4 to 6. And so we're excited to be able to do those activities in person, things that we weren't able to do over the last year. And again, we do need cooperation and compliance from our families so that, you know, we can move forward with those activities that we all look so forward to. And we are welcoming back our teachers here in just a few weeks on August 31st. And so they will be working closely with us as we finalize these plans so that we can open schools and allow our students and families to feel welcome and safe. So thank you.
Thank you, Jennifer. And we will now introduce Max Torgerson, Principal of Nashua Kiwaton High School.
Hi, thanks for having me. So as Superintendent Grose and Jennifer said about their two school districts, Nashua Kiwaton School District is following a similar plan to those two, in the sense that we are going to strongly recommend masks for everyone, but they will not be required as of now. We say this always with the caveat that things can change because these plans are certainly fluid. It is nice to get back to some of these normal school activities. For example, there's some yelling girls downstairs in the gym playing volleyball. And if I remember a year ago, volleyball and football seasons were not happening. So we're thankful for this opportunity to have our kids in the building this week, starting with sports practices. We're definitely going to be working with neighboring school districts. I appreciate the fact that we have this IASC team together, so that way we can bounce off how we're handling specific cases. And doing what's best for students and not just making decisions focused on our students, but using different resources like other school districts and the county and MDH working together to develop these plans for students. Similarly, we will also be sending home exposure letters for students who are, direct contacts of COVID-19. So that'll be something that is a little bit different this year on how the quarantine and direct contact exposures will take care of. Things I've been saying to parents are mostly we need to follow the requirements, and we need that to be a team effort, and we're going to encourage the recommendations. So strongly encourage mask wearing, but not required. We're getting some more information on testing for staff and students. Some more information will be coming on that. And we've already kind of posted our back to school plan on July 30th. We made a Facebook post about our back to school plan. Our website is currently a little bit under construction right now, so I'm not sure if it's up there as of the 2nd or not, but it'll be up there very soon. And we just encourage families to work with us and ask questions on things that they need, so that way we can get through the school year together and do what's best for our kids, providing the best possible education for students while being as safe as possible. So thanks.
Thank you. And joining us via phone is Lee Warren. He is the superintendent at Greenway Schools. Welcome, Lee. You're muted right now. There you go.
Thanks. Sorry, my Zoom isn't working right today.
We can hear you. Great.
I'm sorry, were you asking me to do something?
Would you like to provide an update on the fall plans for Greenway?
Well, at this point in time, we are strongly recommending masks, and that we want it to be an individual choice at this point in time, but we're watching everything very carefully and haven't locked things in yet, but that's what we're telling parents, that we want students to be safe physically and mentally, and we're just monitoring and watching what everybody else is doing at this point.
Great, thank you for the update. And we will now hear from Dr. Bart Johnson, Provost, Chief Academic Officer, Itasca Community College.
Hi, everybody. Like my K-12 colleagues here, really a focus on making sure we're keeping our students and our employees safe and healthy. At the same time, though, really making sure we're providing that academic access and opportunity for our students, making sure that as we go through this COVID pandemic, that we're not stealing away their future opportunities in our response. So we're really excited to be returning fully in person this fall, both athletically and academically and all of our other programming, but certainly facing head on how we can do that and keep everyone safe and healthy. So we are working across the whole Minnesota State college and university system, is providing statewide guidance around some of our COVID mitigation strategies. So many of the things that we're doing at Itasca are true for the rest of the community colleges in Northeast Minnesota and for colleges and universities across the state of Minnesota. So those common strategies we are requiring masks this fall. And that mask requirement depends upon the county transmission numbers, and Itasca County and St. Louis County are in those transmission rates where masks are required by students, employees, and visitors while they're on campus and indoors. Employees, as part of the statewide employee mandate, are required to either have immunization for COVID or going to undergo routine testing. So we have employees doing. Some employees have done the immunization, others are going to do the weekly testing process as a state employee. I'll even get to athletics. Pretty hard to ask them to wear masks. As a former high school and college athlete, that's not too realistic. So there we are going to weekly testing with our athletes. And if they're immunized, they don't have to do the testing, but utilizing that as a mitigation strategy for this year instead of the use of masks, which are not a practical value while students are exerting themselves either in practice or in games. We're also with groups that work and live closely together. So certain student groups and certainly our housing students on campus to really look at where these potential hotspots could happen. those groups where they got those close living quarters, and again, we're not realistically able to make sure they're wearing masks all the time, they will also undergo either weekly testing, or they can get out of that testing if they've gone through the immunization process. And so we're really looking to try to keep that balance and making things happen, great learning opportunities for our students and great programming opportunities, but also making sure that there's a solid COVID mitigation strategy that's actually practical for each of those different groups. And we will be doing contact tracing as we've done before to track as we have things that come up. So thanks for the chance to share an update from the college perspective.
Thank you. And we will now move to the question and answer portion of our briefing. And we have asked our media to identify themselves and submit their questions via the chat. First question, Greg Grell, WDSE Public TV. For Superintendent Grose, will the rapid test be conducted by staff, school nurse, or will local clinics or hospitals or the Minnesota Department of Health be conducting these tests?
I see a couple questions related to that, and so I'll try to hit as many of them as I can. We're still learning about how the rapid testing program works. The little information that we have right now looks like there may be rapid testing available for our staff to conduct in the schools. Again, that's something that we have to work very, very carefully around and make sure that parents are notified and give permission. I know that there are some waivers and ordering of testing that has to be figured out. That's all being figured out by the Minnesota Department of Health as we speak. And but if you look at the Minnesota Department of Education testing page, you'll see some more information about that rapid testing option. But it looks like it may be something we can do in-house. It looks like it may be something that we'll be able to send home with parents, depending on the test and depending on how that program gets set up. So I know they're still working through details of that at the MDE and at MDH.
Thank you. And Emily Ness from WDIO had also had that similar question. So Ryan Half from KBJR. For any school leaders who care to respond, when it comes to strongly recommending masks, is it a one-time request, or do you see it more as a frequent reminder to students and parents? Max or Jennifer, would either of you like to respond to that one, or both?
Sure, I can answer that. I think it's going to come down to just continuing to inform parents and families on this is what the experts are saying is what's going to be best for students. So if they're saying we're highly recommending masks, I'm going to trust MDH and CDC to make those recommendations to schools and say, parents, this is the information we have. That's what they're telling us is, you know, best for kids' school safety in schools as far as COVID-19 is concerned. And I think frequent, you know, relays of those messages to parents and kids, it's going to be important.
I can respond as well. Our superintendent, Dr. Peshta, has recently released a video sharing with families what our hopes are with masks. And I know both the high school principal, Mr. Acree, and I will be communicating with families. And then we'll continue with regular communication out. And certainly if individual families had any questions or concerns, they can reach out to their building leaders at any time. And we're always welcome to have conversations with them about masks.
Thank you. And this is for anyone. How do schools plan to handle pushback from parents who want to or don't want to see students wear masks? And Superintendent Grose or Superintendent Warren, would either of you like to chime in on this?
I'll just piggyback a little bit on that previous question and lead into this one. You know, mask wearing became normative behavior last year. It was a requirement. Our kids got used to it. And so we're expecting, and we're going to build, we're expecting to build on that this fall, that we're going to ask parents to continue to use that behavior that became normative to have a high masking rate. And so I think that's what we're going to see, but we are going to have to continue to encourage that. And the other thing that we want to make sure that people know too is that while there might be some students in our classrooms that don't wear masks, our teachers, our educators every day are used to balancing differences between children. and looking for behavior that might not be pro-social behavior, or that might be harassing about one difference in a student versus another difference. Our teachers do that every day, and we'll expect that they'll continue to do that and watch student behavior and make sure that whether a student is masked or isn't masked, that they're having a good educational experience. We got pushback last year relative to masking for or against. We're getting pushback this year for or against masking. It's something that we've been dealing with, and we'll continue to do that in a respectful way. I think the importance is that we continue to communicate, that we treat each other with respect, and I've been very impressed with the civility with which the messages and the emails have come. And so I really have appreciated that. But pushback will be here. There are various opinions, like you said, Kelly, on this issue. And a main thing that we're going to continue to talk about is our need to be flexible as the situation change.
Thanks. This next question is from Britta Arendt at Herald Review. Restrictions regarding sports or fans this fall. And I'm actually going to, because Itasca Community College is a little further on in this process, although we understand it's different than the Minnesota State High School League. From a public health standpoint, I have not seen anything come out yet. And we will let our K-12 leaders speak to that. But Bart, do you want to talk if you've heard anything at the collegiate level?
Sure, I'll share. First of all, we have been watching the MDH on their health recommendations for sports activities, and unless I've missed it, there haven't been any recent updates. So for the colleges, they made the decision that it's this simple, that if an individual is exerting themselves as part of an athletic activity, they don't need to wear a mask, but that's where the testing, weekly testing requirement comes in to help safeguard. And in terms of games and events where the public is coming, the public obviously is sitting there and they're not exerting themselves, so they wear a mask, but the athletes themselves don't need to wear a mask during that times as they're exerting. And the same is true for our sideline officials, our referees. If they're the ones exerting themselves, they don't have to, but if they're in a position where they're not moving around, asking them to wear masks, and trying to find that balance there so that the public can be part of those activities. And I don't know if where K-12 will go with their athletics, but I think we saw last year, and I'm done some youth coaching, the idea that we're going to ask athletes to wear masks while they're playing, it pretty soon's off their nose, and then it's off their mouth, and then it's just hanging underneath their chin. So I mean, we tried that last year, and wearing masks everywhere didn't work when it came to athletics.
For the K-12 standpoint, Superintendent Grose or Max at the high school level, have you heard anything regarding any restrictions in the fall for athletics and events and fans?
I have not seen anything specific to fans and events. I know right now the Minnesota State High School League released a update a week ago today, actually on the 12th, which you can find online. But essentially says similarly to the college level, where masks are recommended and encouraged for individuals who are not in active participation or competition. So no masking requirements as we saw last year during winter sports at this time, but recommended for students when they're not in active participation. For events and stuff like that, I imagine Minnesota State High School League is going to make an announcement here soon before scrimmages for volleyball and cross country, and with fall sports, I guess, start a week from Saturday. So I'm sure we'll see some guidance before next Saturday.
Great. And we have 2 minutes left, and we have one final question from Emily Ness. And I'm going to direct this one to Superintendent Grose, as it's been discussed for the past few weeks. Why not require masks?
I'd say there's a couple things related to that. One has to do with if I use Dr. Johnson's example earlier about vaccination requirements, that requirement is coming through the state and his requirement, his obligation to follow along with that state requirement. Last year, we had state requirements around masking, and we had state requirements around offering online learning, and we had state requirements, and that created the environment in which we could operate, and both from an enforcement and from a legal perspective. We don't have that environment right now. And so that means that these decisions ultimately fall on school boards, and the enforcement of those decisions falls on school leaders, principals, people in the schools trying to enforce a policy. And that enforcement becomes very, very challenging in an environment when there's not any type of cover at the state level or cover at even at the MDE or MDH level. Their language was very specific about strongly recommending, and that's what we're doing. They could have said strongly recommended that districts require, and they fell short of that. The CDC didn't say strongly recommended that districts require, and that may be semantics, but I don't believe it is. It's a significant difference in language, and so it creates an environment that we have to sort of operate within. And so rather than focus on the language around that, I think our goal is to strongly recommend it, increase mask wearing by incentivizing and encouraging, getting the word out that we know that, just looking at the flu rates last year, that masks had an impact on that. And so we're just going to encourage good behavior.
Thank you. And it is now 10:31, and this will conclude our press briefing. Thank you for joining us.
UPM leads the integration of bio and forest industries. Our constant aim is to produce more with less. That's what Bio4 stands for. Paper is true Bio4 product made of renewable and recyclable raw material. It remains sustainable throughout its whole life cycle. UPM Bio4, beyond fossils.